As demand for GLP-1 pills and shots surges, healthy habits are still key. Add AP News as your preferred source to see more of our stories on Google. Add AP News on Google. Add AP News as your preferred source to see more of our stories on Google. Share whether they are using weekly shots or daily pills. More Americans than ever are turning to anti-obesity drugs to lose weight and boost health. About 1 in 8 U.S. adults say they are taking a GLP-1 drug, according to a recent survey by the health research group KFF. Just since January, more than 600,000 prescriptions have been written for Novo Nordisk's new Wegovy pill, the company said. Early analysis suggests that more than a third of users are new to the drugs, according to Truveta, a healthcare data company. But medication alone isn't the answer. Experts caution. It also takes lifestyle changes, healthy diet, exercise, adequate sleep, and stress management to reap the biggest benefits from the drugs known as GLP-1s. The biggest mistake people make with GLP-1 medications is thinking the prescription is the treatment, said Dr. Catherine Saunders, an obesity medicine expert at Weill Cornell Medicine and co-founder of Flight Health, a weight loss treatment company. GLP-1s can spur weight loss and health benefits on their own, but the effects are larger and last longer when the drugs are combined with lifestyle changes, a recent review of nearly 36 studies found. Here's what experts say you should know about GLP-1 drugs and healthy habits. It's not all about weight. Obesity is a big driver of chronic disease, including conditions such as heart disease and diabetes. But the focus should be overall health and not just the numbers on a scale, said Dr. Jody Duche, an endocrinologist and obesity expert at Harvard Medical School. Health is what you eat, how much you move your body, what is your blood sugar, what is your blood pressure, what is your cholesterol, she said. All of those things are really important. The GLP-1 drugs work by targeting hormones in the gut and brain that slow digestion and target appetite and feelings of fullness that affect levels the playing field, said Saunders, making it easier to adopt healthy habits like eating less and moving more. Social media and advertising sometimes create the impression that these medications are a quick fix, but obesity is a complex, chronic, progressive disease that requires ongoing medical management, she added. This article is part of AP's Be Well coverage focusing on wellness, fitness, diet, and mental health. Read more. Be Well. What does research show about GLP-1s and lifestyle changes? The clinical trials of anti-obesity medications like Wegovy and Zepbound included structured lifestyle programs along with the medication, which are advised along with every new prescription. That results not only in significant weight loss, but improved health markers. A February study of more than 98,000 U.S. military veterans found that those who used a GLP-1 and adhered to 6 to 8 healthy habits had a 43% lower risk of serious cardiovascular events such as stroke and heart attack than those who didn't use the drugs and followed 3 or fewer such habits. Lifestyle habits can substantially amplify the benefits of modern medications, noted Dr. Frank Hu, a lead author and chair of the nutrition department at the Harvard T.H. Chan School of Public Health. Read more. Which changes are most important to maximize the benefits of GLP-1s and reduce potential side effects like nausea, vomiting, constipation, and muscle loss? Duche and other experts offer specific advice. Maintain muscle by eating 20 grams to 30 grams of protein per meal, which could include fish, poultry, nugget, and beans. Eat more fiber and drink more water, as much as 8 to 12 cups a day. If heartburn or nausea is a problem, avoid fried foods and spicy foods and don't lie down after meals. Aim for 150 minutes of aerobic exercise a week, or, ideally, about an hour a day. Add in 30 minutes of strength training 2 or 3 times a week, such as lifting weights or using resistance bands. Get enough sleep, 7 to 9 hours a day for a healthy adult. Take steps to reduce mental and emotional stress. Finally, check in with a healthcare provider about your progress. The GLP-1 drugs can have rare but serious side effects, the experts noted. Someone really does need to keeping track of what is the pace of your weight loss, what are your side effects, and not just mailing you a prescription every month Dusche said. The Associated Press Health and Science Department receives support from the Howard Hughes Medical Institute's Department of Science Education and the Robert Wood Johnson Foundation. The AP is solely responsible for all content.